is definitely okay if they don't want to have that conversation. I think that, again, it's how you ask the question. So maybe it's about asking a patient, how would you feel if we were to talk about the impact of intimacy in relation to your stoma? They then have a choice as to whether they want to have that conversation or not. You might want to invite them to think about the fact that they may not want to have the conversation right now, but that this is a space where this conversation can be discussed together with other topics. I think that's really important. What you don't want to do is make a big deal out of this. Okay, so now we're going to talk about sex and you look uncomfortable, they look uncomfortable. What you want to do is make them feel really comfortable, and you want them to feel like, okay, this is just a part of my life, together with diet, together with sleep, together with exercise, together with the importance of socializing. And included in that is my relationships and intimacy. And so it means that they know that this is a space where they can cover all of those topics and feel comfortable doing so.
I think as well, at the beginning of the patient's journey, it's important to note their surgery that they've had. There are some surgeries which will, to talk about intimacy and sex in the early days is so important. So if somebody's had radiotherapy, particularly ladies, they need to start dilating, do vaginal dilating from an early point. Otherwise, it will affect their sex life, affect penetration further on down the line. So I think it's important to as a nurse, involve yourself in the full journey of the patient rather than having the vaginal dilators boxed off with the radiotherapy team. So don't assume that they've done that, because they may well have given the patient the vaginal dilators. Here you are, have a go. And that's it. So the patient will then sort of look at those, and they don't look the friendliest things. So and then they may well just use them as a doorstop or whatever and leave it be. So I think it's really important to not assume that somebody else has ticked those boxes, and ask the question, have you tried? And if you haven't, then set the scene and try and encourage the patient to do that. And it does open up all sorts of different topics once they start talking about vaginal dilators, and it may well make you uncomfortable, but I think it's a really important thing to do.
Yeah, and I think also as well, it is important if you do feel uncomfortable as a nurse when the patients are talking about maybe sexual practices or vaginal dilators, that you work out a way to summarise what it is that they're saying, help them to understand that, I am on your side here, and give them services that they can go to talk about it in more depth.